Hello everyone and welcome to my needs assessment video. This is week 5. So for this week we are talking about a needs assessment for a specific population. So what is a needs assessment? Well, the purpose of a needs assessment in healthcare is to gather the information required to bring about change beneficial to the health of the population. It is generally, but not universally, accepted that this takes place within the context of finite resources. So, the problem that I have decided to focus on for this assignment is something that's very near and dear to my heart. And it's really based on the number of patients that I see daily that fit into this scenario. And that is elderly people that do not have a dental insurance. And specifically, we're going to be looking at Colorado because I live in Colorado and I deal with these people on a daily basis. So, my experience as I'm talking about, the office that I work at, the doctor has been practicing for many, many years. His clientele is mostly the same that he's had for a long time, and so the majority of them are elderly patients. So, I would say about 80% of the patients that I see are elderly, meaning that they're 65 years or older. So the majority of them do not have insurance, and so they all pay for their dental work out of pocket. And a lot of them are slightly strapped financially, and so they try to kind of cut corners as best as they can. So a lot of them are really sensitive to x-rays. They don't want to pay for x-rays, and so I always try to talk to them and convince them that they need them, but that's one of the things that they just can't afford, and so they understand what the need for them, but they just can't afford it, and so they don't do it. So after dealing with this all the time, I really have started to think, what can we do to help them and help them have better access to dental care? So some demographics about the elderly population in Colorado. As of 2016, 13.5% of Colorado's population are senior citizens. Colorado has about 5.7 million people, which means there are approximately 769,500 senior citizens living here. However, the Colorado State Demography Office states that by 2030 there will be approximately 1.27 million 65 plus year old adults. So that's quite the growth in 10 years. So, some racial characteristics in Colorado: we are predominantly white, so 69% are white. Hispanic is the second most, which is at 20.9%, followed by Black, Asian, mixed, and then other. So, mostly white. Some other characteristics specifically towards senior citizen that would affect their health care is most of them are immunocompromised. They a lot of times have some serious health issues, such as diabetes, cancer, cardiovascular problems, Alzheimer's, lots of different issues that they're dealing with, which means a lot of times they have more medications. And a lot of times they might not be able to take care of themselves, specifically if they have like arthritis or even Alzheimer's. I had a patient the other day that had severe Alzheimer's, and she had a caretaker, and she had a lot going on. And a lot of times they might not be able to transport themselves to their appointments, and so all of these can contribute to different issues with their oral health. So I really, really like this index that I found through the Colorado Health Institute. And basically, it's talking about the amount of risk factors that each patient or each elderly that's 65 plus years old or older experiences in the state of Colorado based on where they're located. And so the lighter colored shades are areas where there are less risk factors, and the darker colored shades are where there are more risk factors. So looking at this and thinking logically, I think some of the lighter areas are where there are bigger cities or also the ski towns. So Colorado Springs, Denver, Vail, Silverthorne, that area tend to have less risk factors. And I think this might be attributed to income status, whereas, looking at the southeast corner, there's darker, which means there's more risk factors. Tend to be the smaller towns, less access to care, that whatnot. Same with the northwestern corner. So I think that might be directly related to income. Here's another chart just talking about risk categories, depending on education, different types of limitations. Most of the ones on the right side are all health issues, so this can absolutely cause serious issues with their overall health care, and you can see how these would affect their oral health care. So it's going to specifically dental characteristics. Elderly people are more likely to have decay. They're more likely to have periodontal disease. They have dexterity issues, which can lead to decay and periodontal disease. And as I stated earlier, most of them, or not most of them, but many of them may rely on a caretaker. And these systemic diseases that I mentioned earlier may also contribute to their oral health status. So basically, looking at all this, we know that these are the patients that absolutely need dental care more than others. These are the ones that have the dry mouth and the decay, and they just really need the help. And so not having insurance, the majority of them not having insurance, is honestly a serious issue. So there's a couple different healthcare programs in Colorado for senior citizens, and these are just a couple of the more popular ones that I found. Senior Mobile Dental, Salud Family Health Center, and the Family Dental Clinic at the Health District. These programs are, kind of like Medicaid and Medicare. They provide access to care for patients, and they're able to come in and get dental care. And they're great programs, but they're still limited. There are not that many in the state of Colorado. So with all the senior citizens that we have, what else can we do for them? So then I looked and I found that a Senate bill was passed, and it was created by the Colorado Dental Healthcare Program for low-income seniors under the Department of Healthcare Policy and Financing. The purpose of this program is to promote the health and welfare of Colorado's low-income seniors by providing access to dental care to individuals aged 60 and over who are not eligible for dental services under any other dental health care program, such as Health First Colorado. The Colorado Dental Health Care Program for Low Income Seniors provides grants throughout the state to local areas on aging, public health agencies, community health centers, private dental practices, and other community based organizations who meet application criteria developed under the guidance of the Senior Dental Advisory Committee. And I think for me, I like to point out that this provides grants to private dental practices because I feel like private practices need to be helping the senior citizens more than we are. I think if more private practices had grants or were able to provide more care to the senior citizens and make it more affordable, we would have a we would lower the amount of people that don't have access to care. So, some of the gaps and barriers with what we have going on is kind of what I've already been alluding to: access to care and availability to care. We don't have very many of these programs out there that give people access. Location of these existing programs: a lot of people don't live close by any of these, and so they just end up going without any dental care. And then funds given to the patients. So, this specifically, I like to think about when we think about like Medicaid offices, dental offices. A lot of times, the quality of this care, which leads into the next point, isn't going to be the same as a private practice. Not that, what they're doing is bad, but a lot of times the funds that they have are very limited. And so if a patient needs a crown, they can't get a crown. Instead, the doctor's going to recommend an extraction on the tooth. And so the quality might not be as best. And they may not be able to have the ability to adequately screen, routinely assess, effectively intervene, and or coordinate their efforts within a comprehensive network of preventative health services. Still good care, but maybe not quite to the level that they need. And then a lot of times the issue that we have is that a lot of people don't even know these programs exist. I mean, I could tell you probably all the patients in my office that I go to wouldn't even know that these offices exist where they could go get affordable health care. And so they just keep coming to my office, which is good because they enjoy coming there. But a lot of people that don't go to offices at all may not know. And especially with elderly people, they're not up on technology. And so some of the advertising methods that we have might not reach them the way that we would hope for them to. So the solutions are kind of difficult, I think, with this subject. I think definitely what we need to expand on the most is the Senate bill. If we can provide more grants to different private practices to make dental care more affordable, then I think more of these senior citizens would be able to get the treatment that they need, and they would have the quality care that we need. And so I think that might be priority number one. But then if we could also just continue to outreach and open more dental clinics that we can broadcast for the elderly, I think that would be probably second as far as the solutions go. It's difficult, but I think that would be the next best thing to do. So, in conclusion, senior citizens are a population of people that need dental care more than anyone else due to their systemic issues. It's important that we not only make services available, but also advertise the availability of services. This is going to continue to be an uphill battle the longer we try to deal with this and the more elderly that we start to see, living in Colorado as the years go on. But it's so important that we really take care of them. And maybe some of these grants that we can continue to expand upon would help with that. But we need to make them a priority, absolutely. Thank you so much for watching.